here, but we don't have enough space today here. So she's crawling right now on the floor for us to be out of the video. But welcome to the Essence of Medicine. I'm going to let our other doctors introduce themselves. I'm Dr. Abbasi for Essence. Please go ahead.
Hi, I'm Dr. Devashish Sharma. I'm a spine surgeon from India, New Delhi.
I'm Dr. Tayo Suleiman. I'm an orthopedic spine surgeon from TSI Auto Health, Cape Town, South Africa.
And I'm Dr. Nada Farbot Gil-Martin. I'm an orthopedic spine surgeon trained in Belgium and here currently in Inspired Spine.
The balance is mostly on the orthopedic surgeon than the neurosurgeon. But we decided we want to talk about how to keep the spine healthy with non-surgical treatment. And then maybe just mention that if you need a surgery, what else is there to be done? So go ahead. I mean, what do you tell your patient? How do you keep their spine healthy?
Actually, it's generally all those basics which have been told and told maximum number of times. But through that, I think the most important thing is to keep your weight under control and a serious amount of exercise and flexibility put into your life. I think that's primary. I think that goes even primary to intoxicants. Primary thing is if you're keeping the weight under control and if you're being very flexible. And when it comes to lumbar spine, I very specifically talk about hamstring loosening. If your hamstrings are tight, whenever you bend, you're bending on the spine, one day it will give way. So it's a very basic thing to do good hamstring.
So we have keeping the weight under control, mechanical stress on the spine, and then obviously flexibility, and with extra emphasis on keeping hamstring working for you, not against you.
Yes, true that.
So what would you say, Dr. Suleiman, to your patient, how to keep their spine happy and healthy?
I always say
Let's
this.
come closer. I think we need to be
The
closer.
dental faculty of this world, they won because everybody wake up in the morning and what do? We brush our teeth. Why? We prevent gingivitis and infection. The highest concentration of bone in your body today is in your spine. The highest concentration of joints in your body is in the spine.
Yeah.
Now, we've got to get to that stage where we realize that if we don't keep this joint mobile and we don't exercise them or stretch them almost twice daily on a daily basis, we're not going to get a healthy spine. And that has to do with every one of us, right from people that are white-collar job and those that are doing manual work. As a white-collar job person, you sit for so long, typing out on your computer screen, and what happens? You strain your back, you strain your neck, you strain your arm. So every 2 to 3 hours, you need to get up from that sit, do some stretches. There's a couple of protocol out there that you can use that are very good to make you feel better, make your joints move. And if you do that, you are basically promoting your back health, your neck health as well. And the better option also for us is to incorporate it as an household. So the family can exercise together in the evening after having a dinner.
What
or
a
in
great
the morning,
idea.
also doing something about it. We've got to incorporate this as a lifelong daily routine, just like waking up and brushing your teeth.
Oh, that's so amazing what you just said, because I see a lot of people drive half an hour to gym,
Yes.
then to exercise the 15 minutes, then get back into the car, drive half an hour back.
Interesting. If you look at some country, how many percentage of people that have gym subscription actually use it? Sometimes less than 25%.
But secret, that's how gyms makes the money. All
Exactly.
the people who pay it but
Yes.
never use it.
It's like an insurance, right?
Yeah. But involving in your daily family routine, I think I couldn't emphasize it more, that if you organize this in your family routine, how important it is, then as well, use it or lose it. Now, regarding what you said, in the last 10 years, they have this desk that actually they go up. You can work standing and sitting, but as well, I have seen some desks that there is a small little treadmill that you can walk while you're
Yes.
working.
And there's
Have
like
you seen that?
dynamic balls that you can sit on.
Interesting.
Yeah.
Interesting.
Yeah.
Interesting.
So, Dr. Gilmartin, how do you keep your spine or your patient's spine happy and healthy?
Well, first of all, just freshly coming out of the fellowship, I obviously concur with my more experienced colleagues. But like you said, prevention is the key, and mobility. It's all sounds nice, and but it's very hard to translate it to when the patients come there with back pain, and you talk about go to the gym or work out. They always look at you like, go to hell. So, and I said to them, I understand it's easier said than done, but whatever you can do, just go into the pool, just walk laps.
Oh,
You don't even have to do something. Core
very good.
strengthening, aqua therapy. If
Very
you don't want to
good.
do gym, just do that. Keep the core strong.
You offset the weight so you can use the muscle that you never used for a long time,
And it's not
and now it's
hard.
painful to use them. So
Absolutely.
ease yourself in the pool, in the aqua. As a matter of fact, there's something we call pool therapy with physical therapy here in the United
Yes.
States, where exactly, see, all what we said is good for to prevent it, but once you have it, you have to go back to a square zero and then work your way up. And going to the pool, I think, is a fantastic.
Absolutely.
Idea.
Now, what I say my patient that is that spine is made of bone and disc. On those discs are like tire of a car. There's three reasons the tire of a car goes bad. You have a good tire made in Michelin, or you have a bad tire made in somewhere else that they don't put effort in making. That are genetic, you know. Unfortunately, you cannot change that. You come with the genetic you get from your parent, and we know a lot of those things are familiar.
Yes.
Now, the other thing is even a Michelin tire, after you have 200,000 miles, will have wear and tear. That aging process. So any spine will age, and that unfortunately as well, nothing we can do about that. But there are two factors that we can work on. Number one, do you take your tire off road on sharp stones, or do you use it on a regular road? That is like, we know that Olympic level athlete, high level athletes, they overdo it. Their joints are always 10, 15, 20 years older than their chronological age. So overusing is not the thing, but there's something that our body has that the tire of a car doesn't have, and that is regeneration. And all the exercises, all the thing you just said is helping the regeneration take the overhand for our spine to stay and healthy and help us along the way. Now, having said that, um, at certain point, spine become pathologic. Dr. Gilmartin, do you have an idea about by the time you are my age, what percent of the people in the United States have a spine problem?
Uh, that would be at least, I would say my numbers, 80, 90%,
It's actually 74%.
74%.
So by the time you are 50 years old, there's actually only 25% chance that you don't have spine problem. By the time you're 70 years old, there's only 1 to 2% chance you don't have spine problem. These numbers are for US. You come a long way from other part of the world. I'm not sure if they make those statistics, in South Africa or India, but and the fact is as well, you're very right. United States, we have more obesity problem than in other area of the world. So I'm assuming that number will be lower in your part of the world. but
Very
we are-
seriously.
yeah.
We, in fact, the interesting perspective, what I see in my country is that it's more of those adults or middle aged basically making the spine bad when it comes to either their sports
Okay.
or because of classical metro lifestyle where you work 12 hours a day on the laptop, you don't exercise, those things. But
Mhm.
generally old people having diseases is relatively less, even still in my country.
No, when you treat your patient for spinal, what is the average age of them in your practice? In my practice, the average age of those patients is about 55 to 65. What is it in your
It
place?
is little younger, I would say.
You're
It,
younger.
I would say something around 35 to 50, something like
Is
that.
that right?
Yes, yes, yes.
That's amazing.
Sometimes
actually.
we have young discs. We have people. Recently, I operated a patient on a slip disc with cauda equina at 16.
Yes,
Yeah.
sometimes people need with 16.
Yes,
Yes,
Yeah.
yes.
And
In
would you?
South Africa, I would say currently it should be between the age of 32 to 48.
Significantly younger.
Significantly younger. It's a younger population.
Mhm.
And because the nature of job provided, a lot of people still do a lot of manual work.
I see.
And then there's all the issue about compensation issue.
Mhm.
But that aside, there are people that truly have back pain is a lot more manual. And And some of them also have genetic predisposition.
Sure,
because their
absolutely.
grandfather, their father has
Yeah.
it. So we're dealing with a younger population with back problem. And that's
Mhm.
why it's so important to deal with the conservative management
Yeah.
effectively. Because if we don't do that, that patient is going to get to surgical
Yeah.
management. You
Doc-
know,
Dr. Gilmartin, why do you think so their population for this spine problem is or spine needing spine surgery is so much younger than our population?
Interesting you asked because as they were talking about it, I was thinking it's like maybe because their country, their cultural differences, there is more respect for the older population. The younger population takes a majority of the hard work and labor, and so they wear out so much
Oh,
faster.
actually, it's a fact.
it is a fact. It's a fact,
Respect
yes.
for the elder
It's
population.
a serious fact. If you're
Definitely.
around 55, 60 in a
You
regular,
retire.
you practically supposed to do. You can't even dare and go in near the kitchen. There are six people helping you.
And there are other cultural things.
I-
You know,
I
if
need
you
to
marry
move-
to a
I need to move to
family,
India.
the kids, the young wives and all that, they
Yeah.
do all the things for. So
And-
far, you have a gray hair. People
Yeah.
respect you.
Yeah.
No?
True
Okay.
Wow,
fact. I
wow.
assisted a neurosurgeon
I have a
for
lot
the age
of
of
gray hair.
81
Yeah,
Yes.
operating
yeah,
Yes.
yeah.
Yes. Yes.
in
Well,
the United States.
Yes.
I have a
No,
lot
that will
of
not
gray
happen in
hair. I
South
need to move to India because I'm tired of doing all this
Yes,
stuff myself.
Yes. Yes.
Now, eventually, some people need surgery,
Yes. A
and
fact.
that's and that number is increasing because the average age of people. As a matter of fact, I have a graph. I usually give presentation. In the United States, our average life expectancy has been stabilized. Actually, in the last 10 years, it's going a little down. But in every other country in the world, both South Africa and India,
Increase.
I've looked, the average population, age of the population is increasing. So spine will become more prevalent kind of situation. And in many of those spinal situations, we treat without the surgery, and thank God, our with physical therapy, injection, and so on, we are able to fix a lot of problem without the surgery. But then certain group of the people are going to need the surgery. That's why all of us have a job, right?
Yes.
Because if we could help everybody without the surgery,
Yes.
we would be out of job.
True. 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 Very true.
So
Very
what
true.
now considering that in the last would say in the last 15 years the reason for disability in United States was number 2 and became number 1 worldwide. It wasn't among top 10 in 1995. It became number 4 in 2015 worldwide. These are statistics, and is now worldwide. Spine is number 1 for disability worldwide. So I can tell you all your jobs is absolutely secure forever because it's becoming a more prevalent problem. But what cases do you guys, there's a reason you come from South Africa and India here today to Inspired Spine because of this minimal invasive surgery that we do. Now, when we get to the point that those need surgery, what methods do you deploy to help the patient with the surgery?
See, in India, we do work minimally invasive, but like as when I come to your center, things are like twice as fast, twice as good. That's the perspective. That's the reason we flew
We
that
call
far.
it efficient. We
Yeah.
don't call it fast because nobody tried to be fast in the
Yeah.
surgery.
True.
But yeah,
See, a happy patient, which we saw in the morning
Mhm.
operated, it is not even perfectly noon, has already gone home
Mhm,
with zero pain.
mhm.
This is right now impossible in India to do a fusion and make the patient go home the same afternoon. So this is a time shift, and because of your surgery and the skill and that efficiency, and at the same time being that much careful, you were able to do and execute the job in which patient got good result, the hospital stay got minimized, the the load on the patient as well as on the insurance company
Yeah,
got minimized.
whole healthcare.
Yes.
Now we did that surgery. That was as well the revision, and then we went to talk to the patient. Patient was asking you to give $20 to them, $20 to him
Yes.
because you were able to watch that.
Yes.
He was joking.
Yes.
Mm.
Yes.
Now we know people after spinal fusion,
Oh,
they
are
don't
in
feel
pain.
like joking.
No, they are in pain.
And
Seriously.
so, and in this patient, by the way, Amanda, did you give the patient a nice gift basket or something? No, you
Yes.
okay. Amanda is in the background.
I love her honesty.
You should have
The
lied.
message isn't the
Yeah.
but but I think we all had the feeling that that patient is just sitting there,
Yes.
and
Waiting for a
and I
gift.
think that is the idea. This number of people who need surgery are going to increase. We have to have a paradigm shift how we help them.
Yes.
So we are efficient. We can help more of them,
Yes.
and in a more concise amount of time, and be able to let them go home and resume their life as well in a more efficient way.
Very true, very true. Because Dr. Basi, as we were looking through the slides, the number of surgeons are not really increasing that fast.
The management.
So if your patient really doesn't go far, if your patient really stays in the hospital for long, or for that matter, a single level TF stays in the OR for 4 hours, you can't do 5 surgeries in a day. And if you cannot do it, it's not that your efficiency is lost. It's the healthcare which is suffering. It's the
Collapse,
patient which
actually.
is suffering.
Yeah.
The whole system is suffering. The treatment given fast and the patient
Mhm.
goes home faster.
Mhm.
You are doing a better job to the nation, as well as to the patient, as well as to the healthcare.
Thank you. But I just want to assure you that, again, as we talked it before, is that this is like a different mode of transportation. Like,
Mm.
imagine you flew from South Africa and
Yes.
India. How long did it take you to get to us?
24 hours.
24 hours and
About 36 hours.
36 hours.
With
No.
stopovers.
Well, with stopovers. But imagine you wouldn't take the airplane. You would come with the ship. How long would that take?
Months.
Months, right? That is
Yes.
weeks and months. Now,
Yes.
the question is it if somebody only knows how to get to from South Africa or India to United States with a ship, and you tell them you made it in 24 hours, they won't believe you, because if they don't know concept of flying,
Yes.
then they think this is not possible, or you're lying, or
Mm.
something that's right here, and so on. But once you know that there's a different kind of mode of transportation, flying, that you don't have to get into a ship, you don't have to go at that speed, and so on. Not only is actually make it faster, but as well, if you look at the data, flying is safer than any other mode of transportation,
Absolutely.
Correct.
because the and if it would take you 4 weeks to fly from South Africa to United States, then it's something wrong.
I'll lose my job. Yeah.
Yeah.
And
Yeah.
we would never come, and we would never get enlightened about the idea that the surgery can happen. Seeing is believing. If I would
Yes.
see that patient smiling an hour after surgery and having his breakfast, joking with us, and actually going home the same day, then we can actually, as you said yesterday, that it's not that I can do it. If you would come here with the pre-notion that I saw Dr. Basi operating and he's a great man,
It's
that's
only for him.
so the whole point of me coming here is lost.
Yes, yes. I mean, you can see my picture and be
Yeah,
done with it.
yes, yes,
No,
exactly.
and that is exactly what I'm telling. That this is not. You do not need to have superior skills to do this surgery. The same way, you have to be. You're already a good surgeon. No, I'm telling you that it is like flying. You have to learn to be a pilot, but more or less, everybody can be a pilot if they invest their life, energy, and situation to learn the technique. Now, what I'm proud of, what I'm truly proud of, that people get at my level of efficiency with 1/10 to 1/20th of number that I needed to get at that level. This is I'm proud of, that I can pass the knowledge so much more efficient.
Amazing.
Because that is, I think, because of the systems you created, right? It's like you said, because you have gone through it, you have created that system.
Yeah.
It took you a lot of time, but that system, when surgeons from the pan world come to you and see, you are not telling them what problems you faced, you are telling them the final nectar which came out.
Solution,
Yes.
You're giving them
Like,
the
yes.
pearls and then
So it's like I've tried 100 different ways of putting in the Siam. Trust me, dude, this works. You
Okay.
follow this,
Yeah.
this will work
No,
in
No,
your
I-
practice.
I give you a map.
Yes,
And, well, I don't give you all the
No, you
map
give
of
the
all the
actual
ways.
final nectar.
yes.
Yeah, yeah.
in
It's the
navigation
nectar.
system you get
Yeah.
the situation is, the reality is this: advancement in human behavior and human pattern is there. There's no reason today for a spine surgeon not to see a better way of treating the patient, a better outcome, and patient morbidity and mortality being reduced by the technique you use. This
Mhm.
is a roadmap you've given. It's a navigation system which any average surgeon can follow.
And that is
So the
truly
challenge is
point.
to
That's a point.
every surgeon in this world
Mhm.
that's a spine surgeon to advance themselves and not sit with what they were taught in school 20 years
Mhm.
ago, 15 years ago. Go on with the time.
Mhm. No, I did actually a study. Please let Mitch know that I'm coming, but it's going to take a few more because this is important. Now, when I went 13 years ago, I now watched this surgery for the first time. I was in shock and awe.
Hmm.
What I saw that Dr. Tali uh, 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 did that surgery very efficiently, but the system, the environment, everything was so complex, and only few people, like very truly skilled people like Dr. Tali, could do it that way. What I did after that, I thought, how can we make it easier that people like me can do that? So what I did, and I'm a very stubborn person, that's the only thing I got. I'm a very stubborn person. I took that complex thing apart, improved on individual parts, and I put it back together so that you don't have to have extraordinary skill to be able to do that. You just have to have exactly average skills. But if you follow that, and not only you guys by definition have above average skills because you work on the very complex anatomical structure already, but and whatever you learned, you didn't learn it in a weekend course. You learned it over a period of time in a residency. Now, what we don't say our patient, after we are done with residency, we go to a course and we just watch it and then come back and home and do it. What we are trying to do is take it to the next step. That, like when I went to Chennai, I did. By the time I was doing the third surgery, the resident they were picking up, they were good at it. But you see that there, you don't need that much of a number to be able to do that. We are just trying to give those numbers in a very controlled environment. And guess what? That numbers is a dozen cases. That is all what it is. Now the question is, how do we pack that numbers in an environment that you and your patient benefit from that by creating in India right now those small, quick fellowships.
Yes.
This is what we are doing. I'm going to be cooperating with multiple universities, hopefully as well with Dr. Varun close to New Delhi,
Yes.
maybe even in New Delhi,
Yes.
that we create those small fellowship, that we put the people through that initial dozen cases in a
Yes.
controlled environment. Specifically, I insisted that we create that as well in India for international
Yes.
fellows.
Yes. Yes.
They come and spend a week or two.
Yes.
We put them through their learning curve. By the time they go back, they're expert. They don't just watched it on a TV or something.
Yes. Yes.
Right.
They have done it in a correct way. And that I'm really proud of having this cooperation of major universities in India. And I'm really thankful for them that their spirit, like I tried to do that here in the United States. They have to get this exam, that exam, they cannot touch and so on.
Yes.
I'm so thankful for India and giving this gift to the rest of the world, enable me to bring my 30,000 followers online to India to put them through this process so that we can do it right for our patient.
Yes.
So my special thank for my Indian colleague in Camping Consortium in Chennai, Dr. Kailash, Dr. Varun, that is really giving this great
Yes.
gift
Yes.
to the entire world.
It is very important, and actually, your very specific point which you are stressing on is very important. Is most of the conferences, what they happen is everybody comes, does something, and they kind of thinks that they've understood, but when they go home, they're not able to replicate that
Yes.
idea.
Mm.
When you do that cases 6, 7, 8, 10, 20 times, and you see that happening back and forth, back and forth, back
Mhm.
and forth, and with a very standardized algorithm which you decided and created, then they are able to replicate it, and that's the true imparting of the knowledge. Actually, they say it, I can do that surgery in 30 minutes, but for those 30 minutes, I did manage 10 years. So
Yes,
in
yes,
10
yes.
years, I can do that surgery in 30 minutes.
Yeah, yeah. It took me 10 years to do actually be to a point to do that surgery in 30 minutes. Now, I unfortunately, it takes effort to put this all together, but I'm very optimistic. I'm very happy going in 25 that finally have the right elements together
Mm.
to push it out. this surgery, by the way, is not new. We have been doing it for 15 years. But and we trained like or the company who started that trained like 500 people, 500 surgeons, but less than 5% end up doing it
Adapt,
because
yes.
they went and I did a study. I asked many of those people, they all quit between case 5 and 7 because at that time they cut their patient back to clinic and the patient had problem and so on because the way it was set up in the United States still is.
Mm.
You learn in residency, then you go to Vegas, you do 4 hours cadaver lab, you do 16 hours gambling, then you go back home, you try to replicate it, and you're right, it doesn't work that
Yes.
way.
And that is the reason a great technology, which would mean great things, one gets the bad name, does not get replicated, and the whole healthcare finally ends up suffering. It's not only the patient, it's the whole healthcare, and that is probably the reason that many countries are struggling. Imagine a spine patient, as you told, it's the number one killer around the world. It's right now it leading to major problems. Those patients need to be in hospital for 5 days, sometimes 10 days,
Yeah.
2 10 hours or 8 hours or 5 hours. Isn't it mind-blowing? You're doing a great job, actually.
Thank you,
And
thank you.
It's
Well,
amazing. Fellowship without mentorship become those people that undergo that become non-adopter. With Cambin Society and what Dr. Abbas is doing for us is that you have a fellowship with a mentorship, and you can actually take it and adapt it with a protocol and algorithm that is
mhm,
easy, straightforward with navigation system.
yes.
And I think this is key.
Yeah, and I think you're exactly pointing to something that's extremely important. In many places, fellows are seen as a cheap labor.
Yes.
yes, yes,
Unfortunately, that concept has to change because these are the people who are going to treat actual people.
yes,
So for that reason, we have put, as you say, we have navigated this troubled water with something we call soft transition. The soft transition is actually again, everything. Yeah, let me put it this way: I'm a pilot, private pilot. In when you're a pilot, if you do wrong things, you die.
Yes.
For that reason, the threshold to do the wrong thing is so low, and the threshold to teach everything to you in a concise, protocolized way is so high. It has literally there's a checklist. You have to do this before that and that. And I, while I was going through the piloting training, I saw why are we not using it in our in medicine?
Mm.
We should have used it long time ago. Like you have noticed in my surgery that we did today, that half an hour surgery, it was very fast. But when somebody when I say something, somebody repeats that, and then I repeat it back and say 3 times.
yes,
That is called so-called closed loop communication. That is come from the pilot talking to the tower. The pilot says, "This is flight this. I want a taxi to that road," and the tower says, the "Flight this. Go to taxiway 31. Go back to taxiway 42 to the runway 11," and then they repeat it, the
yes,
pilot repeat it, and they confirm that. So that is like one of the things, but as well putting protocols in place. So soft transition is modeled like a flight training because the threshold is so low. That means you start with these steps. Once those steps are checked, you go to the next step and the next step and the next step. And at the last step, you do a transthoracic interbody fusion in 28 minutes and send the patient home 4 hours later. But
mind-blowing.
but when
Yes.
but and we know how long it takes you to get there
Yes,
because we have a obviously we have to adjust it to individual. Now, a part of what we do is we adjust it as well. That protocol is not a rigid protocol. It's a protocol that is adjusted to what you bring to the table.
yes,
Like if you're already doing perk screws,
yes,
that you're in a different place. But
yes,
there's a place that you can come to that protocol.
yes,
Versus if you have done already endoscopy,
yeah,
you are so far ahead of the game. You're already starting somewhere. But if you haven't done any of that, but there's still a place for you to start, and we give you those skills in a very concise way. And that is why I'm really proud that as well Dr. Kailash and Dr. Varun has been very, very influential to transform those to Indian fellowship. So I apologize. I think Amanda is right now is pointing that we have come to end of our podcast.
Dr. Basi, before we end up this podcast, I have a question.
Yes, please.
So, since the time I've come here, you are the man who's doing everything. What drives you to do this good work? Because this is more clearly more than what you would outlive.
Yeah.
Like I saw the Suri in the morning,
Mhm.
and it's available for us to work. Like the kind of technology you're developing. What drives you to do this good work to humanity?
Um, let's put it this way. I come from a country like Dr. Gilmartin, that the resources were very, very scarce. And literally, and lots of people suffer not because they don't work hard, like in your part of the world, not because they don't work hard,
Yeah.
not because they are not good people, but because there is a geographic, there's actually a big thing that the force of the geography. We just happen to be born in a country
Geographic
where,
disparity of income, you can call it.
Yes, yes.
Yes.
And that I have seen a lot of suffering in my life.
Yeah.
Now, my own father had a herniated disc. This is not a joke. We went to a public hospital. He was put on a list of 5 years. He should come back in 5 years
Unbelievable.
waiting list to do that. Now, so and that sort of enabled me to have, number one, how can we be efficient? How can we help more people? But why did my father need 5 years? He could barely walk. He was suffering tremendously. There weren't enough doctors there. There weren't enough hospitals there. There weren't enough ORs there. The technique was as such that you could do only one or two of those surgeries a day. And all of those things, but as well it was obviously corruption, and then if you had money you could go, but we didn't have money. So, and disparity and all of that. Now, and wherever there's a problem, and if you just watch it and just walk away, I think it's hard, to keep your humanity. If you see suffering and you just walk away, it is hard to keep your humanity. So that is why we are giving all our patent free of charge to India. So
Right.
go and build it, build the original. Don't copy the cheap copy, have the original. That is why we are working on Suri to give it to everybody,
Yes.
or neuromonitoring. We are building that neuromonitoring in a cheaper way, and we want to donate.
Imagine you saw me an instrument I've never seen in the world. It's a K wire which you can make it straight again.
Yes.
This shows the amount of seriousness, the amount of love, the amount of dedication, and that amount of humanity.
But
Thanks for everything.
well, I can afford as many K wires,
Yes.
but I want to have something that as well other people can afford. So
Yes.
and yet, so we invested in something that makes that part of the surgical instrument that we usually invest, we just throw it away.
Yes.
You can make it again usable, because we need to, again, you remember my
Yes.
father has to wait 5 years
My bad.
because things weren't there.
Yes.
We have to make those things available now. Well,
Thank you.
no, thank you.
Thank you so
Thank you
much.
so
Thank
much.
you,
We
okay?
face even bigger challenges in South Africa. As
And-
you know, Africa is where poverty is overwhelming.
And that is
And-
actually the exact reason why I went to India to produce those devices, not in US, because I have everything, but the rest of the world just cannot afford American
Yes.
prices.
Yes. Yes.
Now I'm hoping in the next 3 to 6 months we have all those instruments with the prices that is, because it's built in India,
Yes.
everywhere in the world
Amazing.
they can afford it. And we are going to put as well, like, specifically for our African colleagues. I'm hoping to get the industry support to subventionize the fellowship from our African fellows to come to
India.
India.
Yes, absolutely.
To
That
make
would be
it work.
really, really
Absolutely.
appreciated. Thank you
Absolutely.
so
That is
much
our
for
goal.
that.
Thank
so
you.
much.
Thank
Okay.
you. Thank you.
Thank you, everybody, for
Thank
our
you.
podcast.
Thank you.
Okay.